Okay, chapter 12, IV delivery systems and equipment. So like I said, this chapter does not have any calculations in it. It's just an introduction to equipment that we're going to be using to deliver IV fluids, medications, and different products into our patients. So on page 202, Introduction to IV Therapy, it explains that IV therapy or intravenous, intra means within, so we're putting something inside of our veins, is the infusion of fluids into the vein for the purpose of providing blood or blood products, water, medication, and nutrients. So there's various reasons that we're going to be administering medications and other products through patients' veins. A lot of times we do this because the patient needs the medication or the fluids quickly, and they need it to be absorbed into their bodies quickly. So the IV route going directly into their veins and the blood is the most efficient way to do that. So someone who's very dehydrated, we can give them fluids through their veins, and that will correct that situation. If someone's malnourished, we can also give vitamins and nutrients through their veins and medication. So if you've ever been in a situation where you've had surgery or broken a bone or something like that and have needed pain medicine, would you much rather get a pill to swallow, or would you get pain medicine through an IV? Which one would you want? IV, yeah, because you're just going to get almost instantaneous effects from that medicine. So that's the big reason we use that. So we administer these products into the vein through an IV catheter. And so when we place an IV catheter into our arms or legs, it's called a peripheral catheter, okay? Peripheral IV catheter. So most frequently you'll see nurses place these in the medical field. If they're placed into a large blood vessel, such as there's a jugular vein in your neck, there's subclavian veins, those are called central venous catheters, and those are usually placed by doctors. Some specially trained RNs can do some of them, but those go into larger vessels and can be a more long-term use for intravenous therapy. So when we administer fluids by IV, that can be introduced or infused continuously or intermittently. So if we have something that's continuously being infused, that means it's being infused all of the time, right? So an intermittent infusion means that it's occasionally being infused. So we might give it for a little while, then stop, give a little while again and stop. So continuously or intermittently. And when the physician orders IV fluids, for example, there's two examples on page 203. So the top physician orders, the provider has written the flow rate for these IV fluids in milliliters per hour. So the doctor is telling us as the nurse or the healthcare provider, IV fluids, D5W/0.45%. That means D5.5 normal saline to infuse at 125 milliliters per hour. Okay. The second physician order says IV fluids, infuse 1 liter of normal saline over 8 hours continuously. So those are two different sets of orders. They're both telling us that we need to infuse IV fluids. That bottom one told us the total amount for us to infuse and the total time of infusion. So given that information, we have to determine how many milliliters per hour we're going to infuse that fluid, okay? So we're going to talk about how the different equipment we use to infuse the fluids, and it'll make a little more sense when we talk about why do we need to know milliliters per hour. Types of IV fluids that we're going to give, they break them down into two groups, crystalloids and colloids. So crystalloids are liquids containing dissolved substances such as sodium or chlorine, and you see the list of different solutions there, normal saline, half normal saline, D5W, D10, etc. A lot of times these are given for electrolyte imbalances and dehydration. And then colloids are fluids that have large undissolved particles such as proteins, carbohydrates, fats, or animal collagen. And those help with volume. So it says the particles increase the oncotic pressure within the blood vessels. It pulls excess fluid from the cells and the tissues and goes into the bloodstream. So that expands the plasma volume of the blood in helping that patient. Okay, so albumin, dextran are two of those that are listed there. Okay, several safety precautions when we're administering IV solutions, IV fluids, and you can read those there. So what do we need to give our patients IV fluid? Okay, we have IV administration sets, and once the nursing students get out of class, I'll go across the hall and get some of the equipment for you to see. I just didn't want to interrupt class. Primary IV administration sets. Okay, so this is the tubing that we're using to connect the bag of fluid to our patient. Okay, so if you look on page 206 and 207, those are two different types of IV administration sets. Okay, so IV tubing, you might hear it called for short. Now, the thing about tubing is it has what we call a spike at one end, and then you're going to see a chamber that holds a little bit of fluid, and the fluid drips into that chamber, and it's followed by some tubing. Okay, so you're going to have a bag of IV tubing, or IV fluid, sorry. Okay, and then you're going to have this IV administration set that has this little spiky thing, for the lack of a better term, right? And then it's got a chamber. And then that chamber is a cylindrical clear chamber that you're going to see some fluid in, and you're going to see drops falling. And then it's connected to tubing, which connects to your patient. Okay. I'm not an artist, didn't go to art school. Okay. So what's important for us to know is that these tubings come in different sizes. Okay. And the sizes are explaining how big those drops are that fall out of the tubing sets. And once I bring one in here for you to see in real life, it might make a little more sense. Okay. So if you look on page 206, I mentioned the size of the drops that are coming in here. Now these tubing sets come in different sizes, and they might be 60, 15, 10, for example, drops per milliliter. GTT is an abbreviation for drop. Okay. So what this means is for every 60 drops that come out of this little needle that go into the chamber of fluid, that's going to equal 1 milliliter. In this one, there's going to be 10 drops. For every 10 drops that fall, you're going to have 1 milliliter. So if you can kind of picture that in your mind, if it only takes 10 drops to be equal to a milliliter with this tubing, but it takes 60 to make a milliliter in this tubing, which one has the bigger drops? The 10. So you're going to visually be able to see large drops come out of this 10 drop tubing versus the 60 drop tubings be a little bitty like this that I've drawn up here. Okay. So why is that important? Because we have primarily two different ways that we're going to be administering IV fluids to our patients. Okay. It's going to depend upon the situation that you're in, the facility that you're in. Multiple factors are going to determine how you're going to administer IV fluid to your patient. So let's just talk plain IV fluid like this. We can administer it most commonly in two ways. We're going to be using an IV pump. So most of you have probably seen an IV pump before. It's an electronic device that actually uses pressure to pump liquid with this tubing into the patient. Okay? The other way we're going to infuse fluid into our patient is by gravity. So we're literally going to have this bag of fluid with the tubing hanging on a hook, hanging on the wall, whatever the case may be, and gravity is going to infuse that fluid into the patient. Okay? So depending on how open the tubing is, how fast it can go into the vein. So with gravity, there's going to be multiple factors that could influence how fast that fluid can go into our patient. If you've ever had an IV in your arm, what happens if you bend your arm? Well, other than it hurts, yeah. So if you kind of bend it off, that it's going to take more pressure for that fluid to go into your vein. Okay, so patients moving or how high you have the bag hanging or how low could determine how freely that fluid is going to enter your patient. So if you have a patient and you're administering fluids or some medication that's very critical for your patient to have a certain amount of, do you think it's going to be better to do that by gravity or with an infusion pump? Infusion. An infusion pump, because that pump, we're going to calculate and punch or program into that pump exactly what we want infused into our patient. And it's going to use varied pressure and these sensors to make sure our patient gets that amount that we enter into that program. If we're only using gravity, patient rolls over, kinks the tubing, there's no beeping to let us know that, hey, your patient's not getting the fluid that they're supposed to be getting. So a lot more monitoring would need to take place and a lot more calculation to make sure they're getting what they need. Okay, so those are going to be two different delivery methods that we're going to give. Now, are going to use. On page 207, it mentions secondary administration sets. The difference between primary and secondary administration sets, if you've ever seen, and I'm sure you have, especially recently with COVID, like a picture of an ICU room where the patient has multiple bags of fluid that are going into their IV. So primary administration set is the main one that's going into the patient. And say they have an infection and they also have to have an IV of antibiotics, for example. We can take that IV antibiotics and piggyback it onto the main fluids that the patient's getting, as long as they're compatible. So this one would be the secondary set or the secondary tubing. So it kind of, you might hear it called piggyback. So it piggybacks on to the primary infusion, okay? They look exactly the same. They have the spike, they have the chamber, they have the tubing, they have a roller clamp to control the flow, but it's just designed to go into this primary tubing, and the IV pump will be somewhere here, so that secondary connects to the primary before it gets to the pump. Okay. I know you just can't stand the reality of my drawing here.
How does it connect to the tubing? Like, is there a spot for it too?
Yes, so and I'll show you when I bring the equipment in here. So in this primary tubing, and it's not very, the picture in your book on 206 is kind of a dated photo, because if you see those little yellowish, little rubber looking things, they are really rubber, but that is where you stick like a needle or something in to kind of piggyback onto it. If you look at that secondary administration set where that blue cap is, you can see it has threads on it to screw in. So nowadays, more more modern equipment with your primary administration set, those rubber stoppers aren't there. It's actually a safety port to where you just screw something in to attach it. So it connects, and you'll have a couple connectors throughout the length of your primary tubing that you can connect multiple lines to if you need to. Or if you have some medicine, IV medicine in a syringe that you need to give to your patient, you can go to this port right here, connect your syringe to the tubing and administer it there. So it's just going to depend from manufacturer to manufacturer and different tubing type to different tubing type of exactly how many ports and where they're at. But typically they'll have multiple ports on your primary tubing to connect with a needleless system. So they try not to use needles into those lines because basically it just gives you opportunity for needle sticks, and it's safer to not use the needles if you can just screw them in safely. Any questions so far? It's a lot kind of to take in. I was trying to do the Cliff's Notes version without going into too much detail, but I feel you need to have a background of what all this is in order for you to understand why you're calculating or what the word problems are going to be telling you when we do the calculations today. It mentions syringe pumps too, and basically a syringe pump, instead of having a bag of IV fluid in all this jazz up here, you're going to have a syringe that you insert into this pump, and it will push the plunger to administer whatever medicine at a rate that you tell it. So a syringe pump is an electronic infusion pump. That's just the main difference. It uses a syringe instead of a bag with tubing. It goes on to mention different labeling of your IV fluids and tubing. We need to make sure that our bags of fluid and medicine that we administer are correctly and easily identified by the label that's on them. We want the name of the medicine, their patient, the date and time that we've hung it, things of that nature, because those fluids aren't going to be good forever. They'll have an expiration date based on facility protocol or what the medicine is. Same with the IV tubing. The tubing expires within 24 to 96 hours after removal from the packaging. So if you have a patient that's going to be hospitalized multiple days, then we need to know when that IV tubing was initiated so we can change it out to new tubing every so often per protocol.
Joey's trying to walk out with it.
Really? Yeah. Yeah, I've had that happen before. They like to keep their IV access for recreational use. Okay, page 210. Infusing IV fluids using manual gravity flow. Okay, so like I said, we're using gravity. We're not using the IV pump. And so the factors that can alter how fast or how quickly that medicine and fluid is going into the patient can be the height of the IV bag, the size of the tubing, the roller clamp, any kinks in the tubing. Just think like a garden hose. If you've got a kink in the garden hose, you're trying to wash your car, the water's not going to come out like it should, right? So you want to make sure there's no kinks in the tubing. If you have a small IV catheter, small veins, or any clots that might be in the catheter. So, like I mentioned before, gravity flow infusions are measured in drops per minute. Okay, so if we don't have an IV pump, we're doing it in drops per minute. Drop per minute. If we have a pump, all we're going to do is punch the buttons to program our pump to deliver the fluid in milliliters per hour. Okay? So gravity is drops per minute, pump is milliliters per hour. So those are the two types of problems that we're going to learn to do this week in chapter 13. Calculate the infusion by gravity, and by pump. Okay. It goes on to describe other types of infusion devices, PCA pumps, which is often for pain medicine, and pain pumps. So you can read about those. So for your chapter 12 homework and exam, it's going to be multiple choice based on information that was provided to you in this chapter. Okay? So let's take a quick break. I'm going to go across the hall to see if they're out of class and get some of that equipment for you. Okay? Okay. See if I can not trip over this and let you guys see it at home. Okay. The next time everyone's in class, remind me and I'll go get some more of these and I'll show you the drip differences in the drip sizes and stuff. Okay. So this poll needs help. Let's follow. Okay, so this is just one example of an infusion pump, and you'll notice that it's a mess. So we have one that's not connected. He gave me the wrong one. Okay, so we have, pretend this is connected to a bag with tubing. So we would put this into the IV pump, and then the pump will actually put pressure on that little cartridge that I inserted into the pump, and say if I wanted something to be done, and it's going to fail because it's not connected, but what I can do is I can type in to this pump, if the doctor orders 100 milliliters an hour, I just type in 100 and enter and connect my fluid to the patient, and this pump will deliver the fluid at 100 milliliters per hour. Okay. There is limits and alarms set on here, so if you've got that real finicky IV and the patient, either kinks the tubing or kinks their arm to where the fluid can't flow very freely, you're going to get that beep, and it's going to alarm the nurse to check it out. So a lot of nice things for in regards to that for IV pumps. This one also has computer programmed in basically a drug guide, a drug book, so you can actually look at medicines in here. It will also do calculations for you. So some of these critical care calculations that we're going to learn how to do, you can actually put the formulas in here and the pump will calculate it for you. Now, are you going to have one of these everywhere you work? No. For example, when I worked at Le Bonheur in pediatrics, it's facility policy that you have to use an IV pump every time you give IV fluids and medications to a child in the hospital. Say at White River in Batesville or here in the ER in Cherokee, if you have an adult that comes in and just needs like a liter of fluid because they're dehydrated, you might not be using a pump at all. You might just enter it by gravity, okay? So remember gravity, we're doing those drops per minute. And I explained to you that this little chamber, and I know it's hard for you guys to see online. So this little chamber that you're seeing, I have this clamp that's connected to the tubing. If I release that clamp, it's going to let fluid flow into that chamber. You see those drops? I think this is probably a 10 drop set. For every 10 drops that fall, the patient's getting how much? 1 milliliter of fluid. Okay. So when I'm infusing by gravity, what we're going to do is if our doctor says, okay, give 100 milliliters an hour. That's easy for us to type in 100 here. But if I'm doing it by gravity, I need to know how many drops have to fall every minute in order to give that patient 100 milliliters per hour. Okay, so how am I doing that? I'm literally counting the drops next to my watch for a minute once I get that calculation. Okay, is it going to be exact? No, it's going to be approximate. So if it's a very critical care drug or critical to give an exact amount, we're always going to use an IV pump. Okay. Another thing you might see used, this might be used in an ER setting or maybe a nursing home where they infrequently give IV fluids. This tubing set is a gravity tubing set. However, it has a pretty nifty thing on it, and what it is called is a dial of flow. Okay, so you literally dial it to a certain flow. Okay, dial of flow. So you can have it wide open and it'll just infuse as fast as the veins will allow, or you can turn it to where you can't really read it, but you can see how I'm turning it till it gets to a certain number. So for example, this has 40, so I have set it to infuse those fluids at 40 milliliters per hour, approximately. Okay, so that way you don't have to have your watch and count your drops and all of that. It's a little easier to do it that way. So you just have the tubing wide open, have it set at 40, and hope for the best, right? So. And we can play with this a little after class if you'd like to. And I could get some different size tubing. This is an example of your secondary tubing that I was talking about. And it's hard to see because everything's tangled up, but so this is your secondary tubing and it's piggybacked on to that primary tubing. Okay. So it just literally screws on. Okay. So now when you read all that terminology and these problems, you kind of be able to picture it in your mind a little bit. Okay, we had a good spot so far. Okay, let's go into calculations, chapter 13. So calculating milliliters per hour flow rates for continuous IV fluids. So we talked about with an IV pump, we're doing milliliters per hour. So that's what we're solving for, milliliters per hour. So the provider order reads, infuse D5W 1 liter over 10 hours. The nurse should set the pump or controller to what milliliter per hour flow rate. Round the flow rate to the nearest whole number. Okay, so what am I solving for? Milliliters per hour. Milliliters on top, hour on bottom. So what am I starting with in my numerator? Milliliters. So it tells us we have 1 liter. So what does that mean? I'm putting my conversion factor there first, right? So 1,000 milliliters is to 1 liter. Okay. Then what? 1 liter. And what in relation to that 1 liter? We're infusing it over a 10-hour time span. So that's the relationship there. 1 liter fluid infused over a total of 10 hours. So my liters cancel out. I'm left with milliliters on top, hours on bottom. That's exactly what I'm looking for, right? So my problem's set up correctly. 1,000 times 1 over 1 times 10. So my answer is 100 milliliters per hour. Now, as we go through these, if you look at the note on page 219 in the middle, the only information that's needed to calculate a milliliter per hour flow rate is the volume that we're infusing, which is going to be in milliliters for a final answer, and the time of the infusion in hours. So those are the only 2 bits of information we need to convert or to calculate milliliters per hour. Okay, so for examples 2 to 5, refer to the directions in example 1. Example 2, provider order reads, infuse LR, which stands for lactated ringers, 500 milliliters over 2 hours. The nurse should set the pump or controller to what milliliter per hour flow rate and round to the nearest whole number. Milliliters over hours is what I'm solving for. What do I know about milliliters? We have 500 of them. What in relation to that 500 milliliters?
2 hours.
So 500 over 2?
250.
Almost too easy, right? Okay, example 3. The hardest ones of these are going to be the ones you have to put a conversion factor in. Provider order reads, infuse 0.9% sodium chloride solution, 2 liters over 24 hours. The nurse should set the pump to what milliliters per hour, flow rate rounded to the whole number. I'm starting with milliliters. What do I know about milliliters in my problem?
1,000 milliliters for 1 liter.
They gave us the volume in liters, so we have to do a conversion from milliliter to liter. So 1,000 is to 1. Let's get rid of the liter, and they told us we have 2 of them, right? And what's my time to infuse that?
24 hours.
24 hours. Okay, I canceled out liters. I've got milliliters on top, hours on bottom. Set up correctly, right? So 1,000 times 2
2,000.
over 24. 83.3 round to the whole number. $83 milliliters per hour.
Would you be able to put like, because it says for 2 liters, could you do 2,000 milliliters for 2 liters or no?
Two thousand milliliters on top and 2 liters on bottom.
Like how it gives you in the question, 2 liters or would that be?
That would not, it
No.
wouldn't be the same because that would be equal to 1.
I'm sure. Okay.
So you'd still be missing here. What might?
You would just take out the conversion rate.
So you're trying to do 2,000 over 24.
Oh, okay.
So if you try to do stuff like that, you're gonna mess up.
That's what you told me.
I'm not naming any names, right? So if you stick, hey, you called yourself out. So if you stick to try, stick to those rules step by step, then you won't mess up. But if you're like, maybe this will work, and it won't work. In some instances, you might get lucky, but not on that one. Okay, so on the bottom of page 220, it talks about calculating milliliters per hour flow rates for intermittent IV fluid. So intermittent versus continuous. Intermittent means we're only going to give it for a short period of time, not constantly. Okay. How do you think our calculations are going to be different? The time's going to be different. So we might be dealing with minutes instead of hours. That's going to be the only difference. Our problems are going to be worked the same way. Okay. So example 1, infuse 350 milligrams of ganciclovir diluted in 100 milliliters of normal saline over 60 minutes. Nurse would set the pump at what mils per hour flow rate and round to the whole number. Okay, so we're still doing mils over hours. I'm starting with milliliters, and what do I know about milliliters for my problem?
100
I've got 100 of them. What about it?
over 60 minutes.
Over 60 minutes. I've got mils on top, minutes on bottom. I don't want minutes on bottom, I want what? Hours. So let's get rid of minutes.
So 60 minutes over 1 hour.
Yes. So by putting that conversion in there, I get rid of minutes. I've got milliliters over hours. So my problem is set up correctly. 100 times 60 over 60. What's my answer? 100 milliliters per hour. Irrelevant. We don't need it. So if we're doing milliliters per hour, all we need is our volume and our time. So anything else in that problem, we will not be using. For now. Gonna give you something to look forward to.
I don't know if that's something to
Yes.
for.
Yes. Okay, let's look at example 2. Provider order reads, infuse 500 milligrams of azithromycin diluted in 250 milliliters normal saline over 3 hours. The nurse should set the pump at what milliliter per hour flow rate and round to the nearest whole number. Once again, milliliters per hour. How many milliliters do we have?
250
250
over 3 hours.
over 3 hours. Mils over hours, all I have to do is divide 83.3 round to the whole number. 83. Now, so far, all of our meals per hour have been rounded to the whole number. You might have problems, and especially in critical care calculations later in the semester, where we're going to be rounding to the nearest tenth, because IV pumps will let us we can type in 83.3 into that pump, and it will deliver 83.3 milliliters per hour. Now, if we're going to deliver these by gravity, and say it was 83.3 drops per minute, can we count 0.3 drops?
No.
No. So drops per minute, we're always going to round to the whole number, because we can't sit there and calculate a third of the drop. Okay? So just make sure you pay attention to your rounding rules. So we good so far? Fairly simple so far. On page 222 and 223, they talk about calculating milliliters per hour flow rates for syringe pumps. Guess what? Same thing, mils per hour. Nothing is different except for the equipment that we're using to infuse it, okay? So we don't care if we're using a syringe pump or an IV pump or whatever. What we're worried about is, what am I solving for, okay? We're solving for milliliters per hour. We just have to be careful. Do they give us the volume in milliliters? Do they give it to us in liters? And the time, is it in minutes or hours? So we need to make sure everything cancels out correctly to get what we're solving for. So, since we feel confident so far, let's throw a wrench into it, right? Because Jennifer was looking forward to that. Okay, look at page 224. Calculating infusion and completion times for mils per hour flow rate. So, how many of you are comfortable with military time? Some of you? What time is it right now in military time? Yeah. So it would be 14, if I'm going by my computer, 14:18, okay? So anything after noon, we're adding 12 to it, right? Up to midnight. And then what time would 30 minutes after midnight be? How would you write that down? You can write 0:30. Some people write 24. I've seen it like 24:30. That doesn't make sense to me. It should count. It should start at 0 at midnight for me. So I would say 00:30. And then 1 a.m. would be 0100, 2 a.m. 0200, and on until noon. And then noon is 1200, 1 p.m. is 1300, and on. So it's going to be very useful for you guys to do military time when we're calculating these infusion and completion times. Okay? So 224, calculating infusion and completion times for milliliters per hour flow rates. So at times, the nurse may need to know the time when the current infusion will be complete. Okay? So, I've got this 500 milliliter bag, and I need to know, when is this going to be done so I can disconnect it from my patient. Okay? For example, if a nurse is infusing 340 milliliters of red blood cells to a patient at 125 milliliters per hour, how long is that transfusion going to take? Because red blood cells must be infused in less than 4 hours. So we want to make sure that the rate that we're infusing those red blood cells is fast enough to have that infusion complete within that 4-hour time frame. So we don't have to throw away some perfectly good blood. Okay. So to calculate the infusion time of an IV, the nurse needs to know the present flow rate and the volume that we're going to be infused. It is supposed to be infused. So that time may be expressed in hours or minutes or both. The completion time is determined by adding the infusion time to the current time. Okay, so we're going to have two different things we might be calculating here. We're going to calculate the infusion time. So if I'm infusing this 500 milliliter bag of fluid at 100 milliliters per hour, how many hours would it take? 5, right? So if I started at noon, what time would this be done? 5 p.m. Does everyone understand that? It's exactly what we're doing, only it's not going to be that simple. Okay? So I need to know how much is in this bag, and I need to know the rate that I'm infusing it to determine how many hours or minutes it would take to infuse it. Okay? So the total infusion time would be 5 hours, we said. And then the completion time would be 5 p.m. So two different potential calculations, okay? So infusion time, example 1. Calculate the infusion time for an IV that is infusing at 100 milliliters per hour with 300 milliliters of fluid left in the IV bag. The current time is 11:20. When will this IV be completed? So this was a two-step question. So to calculate the infusion time, what does it tell us to do? So the infusion time, we're solving for hours. Okay? So hour equal. So no matter what I'm solving for, I take what's on the left-hand side, that's the first thing I'm looking at, right? So from my problem in my example 1, what does it tell us about hours?
Milliliters per hour.
For every 1 hour, I'm infusing 100 milliliters, right? So, number 2, multiply the first set of given quantities by the second given quantity, which is the volume of the remaining fluid to be infused. Because do I want milliliters in my final answer? No. No, I just want hours. So let's get rid of that milliliter. Go back to my problem. How many milliliters are we infusing? 300 total. Anything in relation to that 300? No. Let's put it over 1. So I cancel out milliliters. I've got hours left. Okay. So 1 times 300 over 100 is 3. Okay. So my infusion time is 3 hours. So it's going to take 3 hours to get that 300 milliliters infused into my patient. Now it wants us to calculate the completion time. Okay? What is the current time? 11:20 a.m. plus 3 hours. 11:20 plus 3 hours. So your current time plus infusion time.
Are you gonna ask for the answer in supplementary and?
I don't think it specifies in homework. I can't really remember. But you need to either put your time like this or put PM and AM after it, however you prefer. Just so I'll know what you're talking about. I would prefer you use military, but if you're not as comfortable with it as regular time, I'll be flexible. So your infusion would be done at 2:20 p.m. if you started it at 11:20 a.m. Okay, so these are two-step problems. Infusion time, completion time. Now, Where it gets tricky is example 3. Don't yawn. So example 3, calculate the infusion time for an IV that's infusing at 150 milliliters per hour with 800 milliliters of fluid left in the bag. Current time is 0620. When will this IV be completed? So we're solving infusion time in hours. So let's get that out of the way. What do I know about hours?
150 milliliters per hour.
That's my infusion rate. 1 hour is 150 milliliters. Do I want mils in my final answer? Nope. How many mils do I have?
800.
Oh, I was looking at the wrong problem. Yes, it's 800. Okay. What about that 800? Okay, so I've canceled out mils, hours on top. 800 divided by 150. 5.33 hours. So now I need to figure out my completion time, right? So I need to add 5.33 hours to the current time of 0620. Can I say 0620 plus 5.33? No, because what I need to know, time is in hours and minutes. So I need to know how many hours, 0.33 hours is how many minutes? How would you go about solving that?
That's 1/3, so it would equal 20 minutes.
Okay, so if I'm solving for minutes, what's my conversion factor? 60 minutes is to 1 hour, right? And I have 0.33 hours. So 60 times 0.33 is 19.8 minutes. They rounded up to the nearest whole minute, which is 20 minutes, right? It'll be very specific. It should be. So this 5.33 hours really is 5 hours, 20 minutes, right? So this is my infusion time. My completion time is 0620 plus 5 hours, 20 minutes, which is what?
11:40.
11:40. So this is the hardest problem you'll do this week. Now, the last new thing you're gonna learn, I say the last, second to last.
Something else, Susan.
It goes on and on and on. Okay. The good news is we're not gonna go past page 234. Calculating drops per minute flow rates for IV fluids under manual control. Okay, so remember, we were using gravity. We're literally counting the drops that are coming down into this chamber. Okay? The tubing is going to tell us on the label when we open the package if it's 15 drops per milliliter, 10 drops per milliliter, 60 drops per milliliter. So we have to know that tubing size in order for us to correctly calculate the problem. So it's going to be given to us in the problem. So example 1, page 228. An IV of 1 liter D5W half normal saline is to be infused over 8 hours. The IV tubing has a drop factor of 20 drops per milliliter. Calculate the drops per minute flow rate. So I'm solving for drops per minute. So what do I start with? Drops. What do I know about drops from my problem? The tubing is 20 drops per 1 milliliter, right? Okay. Do I want milliliter in my final answer?
No.
No. Let's get rid of it. What do I know about milliliter?
100.
What in our problem deals with milliliter that I haven't already used?
Oh, 1 liter of the sodium chloride.
1 liter of the fluid. So I need to do a conversion from milliliter to liter, right? So 1,000 to 1. Now I can use that liter from my problem. So it tells me 1 liter. What in relation to that 1 liter? I'm infusing or I'm delivering that 1 liter of fluid to my patient over an 8-hour time span. So that's the relationship, 1 over 8 hours, okay? So I haven't canceled out yet, so let's look and see where I'm at. I canceled out milliliters. I canceled out liters. I've got drops on top, hours on bottom. Am I set up correctly? Why?
You convert it to minutes.
I need minutes on bottom. So let's get rid of hours and go to minutes. 1 hour over 60 minutes. That gets rid of hours. Minutes on bottom, drops on top. It's exactly what I want. So all I have to do is calculate. 20 times 1,000 times 1 times 1 over 1 times 1 times 8 times 60. So 20,000 over 480, according to the book, is 41.7. Bless you. 41.7. What am I rounding to? Whole number, because I can't count a tenth of a drip. So my whole number goes to 42 drops per minute. So that means I literally sit here and move my controller to let these drops fall. And when I have it set to 42 drops falling every 60 seconds, that's going to deliver this 1 liter of fluid in 8 hours. That's what it's done. Okay. Clear as mud? Good. So I've tried my best to give you back information or give you, a lot of details about the equipment, about the different situations. But if you don't understand any of that, it's okay, as long as you remember your rules for dimensional analysis. Look at what you're solving for, keep canceling everything out until you have left what you're solving for. That's all you need to do, okay? So even though this might be intimidating and overwhelming, just don't forget those steps and you should be okay. All right? Easy for me to say on this side of the desk, right? Okay, let's do a couple of more. Look at example 3. An IV of 2 liters, normal saline to be infused over 24 hours. The IV tubing has a drop factor of 10 drops per mil. Calculate drops per minute. What does it tell us about drops? Top of page 229. We have 10 drops for every 1 milliliter. I want to get rid of milliliters. So what does it tell us about milliliters? Nothing. It tells us in liters. So I got to convert milliliters to liters. So 1,000 to 1. That gets rid of milliliters. Now let's get rid of liters. What does it tell us about liters?
2 liters.
2 liters. We're going to infuse those 2 liters over the time of 24 hours. So I've got drops on top, hours on bottom. Then what?
Yeah, break down hours in minutes.
Hours to minutes. And you're going to find that with almost all the problems we do with drops per minute. Most of the time, we're going to have to be putting that conversion factor in there because so often the physician's going to order that fluid to be infused over so many hours. Okay. So I've got drops on top. Everything's canceled out. Minutes on bottom. So 10 times 1,000 times 2 over 1 times 1 times 24 times 60. 20,000 over 1440. That comes out to be 13.9. Rounding to the whole number, my final answer is 14 drops per minute. Will infuse that 2 liters of fluid in 24 hours. As long as I have tubing that delivers 10 drops per milliliter. So let's look at some practice problems that aren't already solved for us. On page 229. Look at number 5. I'll have you guys work this. An IV of 750 milliliters D5W to be infused over 8 hours. The tubing has a drop factor of 15 drops per milliliter. So how many drops per minute will you set? So number 5 on page 229. Okay, so we're starting with drops, because we're solving for drops per minute. What does it tell us about drops? Our tubing set is 15 drops for 1 milliliter. I want to get rid of milliliters, so what do I know about milliliters? 750 milliliters over what?
8 hours.
8 hours. Okay, so milliliters cancels out, drops on top, hours on bottom. That means an hour to minute conversion is needed. 1 hour over 60 minutes. So that cancels everything but drops on top, minutes on bottom. So I should be good to go now. 15 times 750 over 8 times 60. What's 15 times 750?
11,250.
Okay. Divided by 480. Oh, 23.43. Okay. So 23.43 rounded to the whole number, 23.
Is there ever any medicines that is crucial that you round up instead of down? Like somebody really needs a strong antibiotic or something like that?
There are instances actually, now for a drop, we can't count. But if we're doing milliliters per hour, when we get into critical care calculations, I believe, what chapter is that, 18, I think, 17 or 18? We're going to be rounding to the 10th frequently. And then in real life, there might be a rare occasion where you would round to the 100th maybe, but the 10th would probably be the most you would round to for milliliters per hour. Yeah. So there are certain critical care drugs that you would need to do that. And not all pumps will deliver at 1/10 of a milliliter per hour. So you will have to make sure your pump is compatible for that. And if you're in that setting, then you'll have a pump that is. Questions so far? You feel okay with this? Maybe with some practice? Okay. Okay, on page 230, calculating drops per minute flow rates from milliliter per hour flow rate. So, so instead of it saying, okay, you have 500 milliliters and you have to infuse this over 8 hours, it's going to say, okay, we need to infuse that at 100 milliliters per hour. Here's your drop factor for your tubing, and then how many drops per minute will that be? So calculate the drop per minute flow rate from a fluid infusing at 100 mils per hour, and the drop factor of the tubing is 20 drops per mil. So I'm solving for drops per minute still, and I'm still going to start with drops first. So the drop factor of the tubing was what? 20 drops per 1 mil. What do I know about milliliters? They want us to infuse 100 milliliters for 1 hour. Cancel out milliliters, drops on top, hours on bottom. I don't want hours, I want minutes. Put my conversion in there. So 20 times 100 over 60. What's 2,000 divided by 60? 33.3. I need to round to the whole number. 33 drops per minute. So it shouldn't matter what information is given to us as long as we're using dimensional analysis. If they give us the rate, if they give us the volume and the time, shouldn't matter. We should be able to calculate it. So the last thing in this chapter on page 231 is calculating infusion and completion times for drops per minute flow rates. Sorry, 231, the bottom of page 231. So to calculate the infusion time for an IV that's being manually controlled, the drip rate, volume of fluid to be infused, and the tubing drop factor must be known. Completion time is computed in the same manner as milliliter per hour flow rates. We already did that. So example 1 on page 232. Calculate the infusion and completion times for an IV that's infusing at 64 drops per minute. 1,000 milliliters of fluid remain in the bag. The drop factor of the tubing is 10 drops per milliliter, and the current time is 0200. So calculate the infusion time in steps. Okay, so the infusion time, we're solving for hours, right? So what does it give us in that problem related to hours? Exactly, it gives us 64 drops per minute, so that means we convert hours to minutes. Start with that conversion factor. So now I can use the 64 drops per 1 minute, right? So for every 1 minute, 64 drops will fall. I got rid of minutes. I got hours on top, drops on the bottom. What do I know about drops? Our tubing factor is 10 drops per 1 milliliter. Hours on top, milliliters on bottom. How do I get rid of milliliters? Our total volume that we have left in the bag is 1,000 milliliters. Put that over 1, because there's nothing in relation to that. Milliliters cancels out. Hours on top. I'm good to go. 10 times 1,000. 10,000. 60 times 64. What is 60 times 64? Okay, so 10,000 divided by 3,840. So 2.6 hours is the infusion time. So that's how long it's going to take that 1,000 milliliters to infuse into our patient. Okay, what's the current time? 0200. So I need to add 2.6 hours. What's the problem with 2.6 hours? I need to make sure I know minutes. How am I going to do that? Solve for minutes. So 60 minutes is 1 hour, right? And then I have 0.6 hours that I'm trying to convert. So 60 times 0.6 is? Okay. So 0200 plus 2 hours, 36 minutes. What time will my infusion be complete? 4:36 a.m. Okay, that's all we're going to go over today. Do you guys have any questions online?
No.
Okay. All right, I will see you guys next week. If you have any questions during the week, just give me a call in my office, shoot me an email. I'll be happy to meet with you online. Don't forget it's midterm week. If you haven't applied to the LPN program, do so. Tell your friends.
When I was gonna be up with you, I was at work and I couldn't really get online with you.
Oh, well, that's okay.
Have a good week.
You too.
So, did the midterm grade going after the midterm test?
No, I actually put in midterms this morning,
Okay, so the A would be the for the
whatever you have right now.
midterm? Okay.
Yeah, I guess that's acceptable, isn't it?
It's a little way.
Yeah, well, there's always room for improvement.
Yeah. I used to, well, my dad was really strict.
Yeah.
So anything above like a 95.
Hey, I'm that way with my kids. I tell them,
What,